Hello. All right, let's do this. This is going to be hopefully the first of many. If you recognize this outfit, it is because I am filming the exact same day as my intro. So sorry about that, but you're not going to get a lot of clothing variety here. Let's begin. So, one of the things that I wanted to touch on is there is one particular type of pelvic floor dysfunction that I feel like women come in and see me and they feel the most confused by. It is something that can kind of have, it has a different sensation that can be listed under a couple of different things. So, what I'm talking about today is I want to talk about high tone pelvic floor. So, when you have a muscle that potentially has a trigger point, or you're just holding a lot of muscle tone in your pelvic floor. Now, this can come from a couple of different scenarios. We always have what we call, like, there's muscular reasons. There can also be neurological reasons. So for the difference between those would be one is coming from a muscular source. So like you have a maybe mechanical reason in your body, in your pelvis, why your pelvic floor is holding tone on the left, right, front, back. It can be any of those. You can also have a neurological reason. Typically, that is coming from the source of the nerves. Now, that can get a little bit more, obviously, in depth. It becomes a little bit more complicated, in my opinion. But that being said, the most common one that I see, probably 7 out of 10 times, is a muscular problem. So, where someone comes to me and they typically say, I'm having a lot of pain. Like my pelvic floor hurts, my hip on a particular side will also hurt. So they'll tell me, hip pain, pelvic floor pain, painful menstrual cycles. Sometimes they can have painful intercourse. Now, painful intercourse in of itself needs to be an entirely other video, but those are pretty classic. They can also say they have problems like, whenever they sit down to go to the bathroom, they're like, I can't fully empty. That's number one. And number two, like sometimes they just can't fully empty. They can't get it all out, which leads to frequent trips to the bathroom all day long because nobody likes walking around with the sensation of, I gotta go all the time. It's really annoying. It's very distracting, especially if you're trying to work or just do something fun. So those are pretty common. The other one is, someone who feels like they have a UTI all the time. They have a little bit of a burning sensation when they pee and they're like, something just feels really uncomfortable, but they go in and they get tested. And sometimes they get tested multiple times and it will come out negative. That's when we know, okay, we definitely have something going on at the pelvic floor level. If we can rule out the urinary tract infection, bacterial, vaginosis, fun word. So if we can rule out all of that stuff and focus it down and to know, okay, it's the muscles. Those muscles are what we're looking at. So that is where seeing a specialist is great. Like if you can go in person to a pelvic floor physical therapist, that's great. There are also some things that you can do at home to self-release if you obviously find helpful videos from a reliable source on what to do, how to handle, the tool. The most commonly recommended one is the pelvic wand. One of my favorite brands is Intimate Rose because it was created by a pelvic floor physical therapist named Amanda. Her site is great. She also has a bunch of really helpful videos on how to use a pelvic wand, how to do self-releases and maintenance type things. So I would highly recommend her website. She also has a YouTube channel, so also might recommend her YouTube channel. But I just always like to educate and tell people that, not people, but like in general, social media and sometimes even medical professionals will default to this state of, oh, you're just weak. You just need to do some Kegels and that should fix it. And that's typically the worst recommendation you can give someone, because if they have a high tone pelvic floor and you tell them they need to go do 1,000 Kegels a day, it's so bad. It's so bad for them. Typically exacerbates and makes their symptoms worse. So they will, try this recommendation for weeks and weeks and weeks. Doesn't feel better. They call their doctor. They're like, hey, I feel worse. Can you please tell me or recommend someone I can go see? They come to someone like me in the clinic and they're like, I've been doing XYZ for a month or two. I feel horrible. Can you please help me? We check the pelvic floor on an internal level and it is just typically very high tone, very taut. If you've ever been to the massage like a sports massage, not a woosa massage, not a feel good, not a spa day, like a deep tissue sports massage. And they get into your glutes or your hips or your quads or even sometimes like your hamstrings and your calves, and they're like working it. That sensation is what we can sometimes get out of the pelvic floor because it is that intense. Now, obviously, we don't want to walk around with tight hips all day, so we definitely don't want to walk around with tight pelvic floor. Now, from the symptoms and sensations that I listed earlier in the video, that's what you're gonna feel, and obviously we don't want to feel that anymore. So the way to improve it is to do the tissue work, release the muscles, but it doesn't stop there. Like, really, we need to learn, why were you holding tone in the first place? Why are you so tense? What is going on? And this is where it does get complicated. And I think this can be a really hard conversation to have with some people because, as women, we know the pelvic floor is a very emotional area. And I know some healthcare providers are probably rolling their eyes right now. And that's fine. That's totally fine. I don't care. But because, like, with people, like stress, birth trauma, past trauma in your lives of unspeakable things, like all of the body keeps score. It's a book. I'm going to pull that saying right now. It's a book. So just know that, we obviously hold tone, hold tension for reasons. And I think you need to get to the source of the reason because honestly, we can use the wand. We can, do pelvic floor releases regularly, but unless we address the source and address the problem of why this is happening, it's just going to keep happening. And maybe something happened, maybe someone was in a car accident, pelvic fracture, maybe their muscles are just compensating for an injury and trying to learn to get back to normal. That may be a really long road and something you may have to do repetitive releases for, but sometimes it could be as simple as, the best example I can think of is if someone's like extremely one-sided dominant in their exercises, then sometimes that can lead to having significant tone on one side. I feel like I see it the most in women who hold their babies on one particular hip. Like sometimes that they hold their babies on one particular hip, a lot of weight is going straight, like they shift their center of gravity to be through one particular side. And sometimes that side has just learned, like, okay, if you have kids, holding them doesn't stop at the baby phase. Like I have a 52-pound 4-year-old and I still hold her regularly. And if she's tired at Dollywood and I don't have a stroller or a wagon, guess what? Like I might as well be rucking because I'm just going to wear her like a backpack or on my hip. But all of that to say, like, it is a significant amount of weight that we take on to carry and do the weight shifting. So sometimes looking at those causations through a woman's lifespan will lead you to why this is happening. Where was I going with that tangent? I don't remember. See, this is what's going to happen. But I just like to educate that if you are feeling some of these symptoms and you feel like you don't understand where it is coming from, it's okay. Just know that if you have tested negative on all the special tests at the doctor's office, if, you have been cultured, you have been, peed in a cup 700 times and you're not getting any results, sometimes I think talking to your doctor or talking to a local physical therapist about, hey, like, do you think I have this? Do you think this is going on? This could definitely be something that is going on with you. It is definitely treatable. It is very easily treatable. That's like my favorite thing in the world. I love doing muscle releases. I love doing muscle work. So just know it's not a hopeless case. There's a lot of hope. Talk to your local pelvic floor physical therapist. If you have a friend who's a physical therapist and you feel comfortable having that discussion with them, they can help point you in the right direction. One thing I always like to say is make sure if you are looking for a muscle internal release work, make sure that the PT physical therapist that you are going to see has their pelvic floor specialty because that does matter. Okay. All right, what else? For more information, check the box below for any descriptions. Anything I mentioned in this video, I will supply down below in the description. And then if you have any questions, as always, please leave a comment down below. I would love to help get back to you if you have any questions. Other than that, have a great day and I hope you learned something.